OCD means Obsessive Compulsive Disorder, and there's two broad types: those that have obsessional rituals and those that have obsessional thoughts. Most people have a combination of both. And an obsession, by definition, is a ritual, thought or act which the person realizes is stupid, but they have to do it to relieve their anxiety. So they know it's a stupid thing to do, but they have to do it. So it's a neurotic illness. If they didn't realize that it wasn't stupid, they would have crossed the boundary from neurosis into psychosis, so they'd actually be severely mentally ill. So it would become a delusion, which is a false belief, rather than an obsession. So assuming the person realizes it's stupid, they've got insight into the fact that they realize the obsession is stupid, then it's a neurotic condition. If it was a psychotic condition, it's to be treated in a slightly different way. So assuming it's a neurotic condition, again, it's the 3 T's: time, talking, tablets, because patients revolve around 2 areas of obsessions. They either revolve around safety and security, or cleanliness and hygiene. It's as though they've all read the same textbook, so that they fall into those 2 groups. So excessively cleaning or washing their hands, or they're worried about bugs and bacteria affecting them in some way, or they're constantly locking the door and rechecking the door if it's safety and security in the windows, keep taking the plug out of the switch constantly, out of the socket, and so on. So again, the standard treatments, time, talking, tablets, can take time. It's quite a resistant illness to treat. And it's involving a chemical in the brain called serotonin. And so a selective serotonin reuptake inhibitor, such as fluoxetine, is a very effective treatment. You might need to give a higher dosage than the standard dosage that we use as antidepressants for depressive illness. So you might need to give 20 milligrams or 40 milligrams or 60 milligrams or even 80 milligrams of fluoxetine a day. And usually, with an adequate dosage, the OCD symptoms come under control if it's combined with quite intensive cognitive behavioral therapy on a weekly or twice a week basis with a CBT therapist, using response prevention and modeling. For example, if the person had a fear of dirt and disease, then part of the modeling is to throw some biscuits on the floor, pick them up and eat them, and then the patient has to pick them up and eat them off the floor as well, a dirty floor, so they can learn that they're not going to become ill because they've picked up a biscuit from a dirty floor. And using those combinations of treatment, most people will get better.